Every morning when I wake up with the sound of the alarm, I will hear the sound of my heart pumping. And like the clock, the rhythm will start my busy day. I may run to my mechanic to fix my car and run to my dentist to fix my teeth. And for sure I have to run to my office to make sure my clients are taken care of. And like a clock, the rhythm of my heart follows my every step. But unlike a clock, my heart rhythm carries a different tune. It's calm and relaxed when I enjoy a good massage. It beats like a drum when I fight for myself or my clients. And it will jump like a deer when I find my dream girl. My heart works hard and never gets a break. Unlike my legs crying out after my fitness run, or my eyes losing focus even at critical moments. My heart stays with me through good times and bad. But even a heart as good as gold needs some tender care. An auto mechanic may fix 10 cars a day, but my heart doctor has to fix more than 100 hearts a day. Don't get me wrong. He doesn't necessarily fix 100 hearts a day, but if he can make one patient feel better, he can hear the rhythm of his family's hearts. He can hear them calming down from the wrenching race. You see, people don't realize your health affects not only you, but also the people you love and people needing your love. One common but often ignored symptom is chest pain. You may feel discomfort or pressure. Some feel aching pains in your chest. Many mistake the signs of burning, squeezing, or fullness as heartburn. Because some people feel pains in the shoulders, arms, neck, throat, jaw, or back, some people fail to realize the danger and consider those only as common cold or flu symptoms. Look, for heaven's sake, take these symptoms seriously. Watch out when one of these symptoms appears. You may have coronary artery disease, shortness of breath, palpitations, irregular heartbeats, or a flip-flop feeling in your chest, a faster heartbeat, weakness or dizziness, nausea, sweating. Of course, I don't mean for you to call for the emergency every time one of these symptoms appears, but you must call for help if you feel you may be having a heart attack, especially when you have these additional symptoms such as vomiting, extreme weakness, anxiety, rapid or irregular heartbeats, a mild discomfort that progresses to significant pain. You may have a serious problem if the symptoms last longer than 30 minutes and do not improve with rest or by taking medications. So don't take a chance on your life. Get help. Go to a hospital right away or call an ambulance. These symptoms are like alarms, so don't ignore them. Some people can have a heart attack without having any symptoms, the so-called silent myocardial infarction, MI. Many diabetic patients lose their fights that way. We have to face the difficulties of fighting the silent killer without symptoms. But although there may not be an alarm, there could still be signs. For example, you should know your heart needs attention when you see symptoms of arrhythmias. I mean abnormal heart rhythms. When you notice palpitations, a feeling of skipped heartbeats, fluttering, or flip-flops in your chest, fainting and feeling tired easily, together with the common symptoms like dizziness, shortness of breath, and chest discomfort. Meet with your health care professional so they can arm you against the silent killer. Ignoring the risk does not make the problem go away. It only makes it worse. Some symptoms not only tell you that you are in trouble, it also may tell you what kind of troubles you are in. For example, if you have difficulty catching your breath even while doing light everyday duties, and when you rest, together with DDPP, I mean dizziness, discomfort, pain, and palpitations, you may have heart valve problems. And if you find swelling in your ankles or feet, even your abdomen, or just feel bloated and with quick weight gain, like 2 or 3 pounds a day, you may be having a heart failure. Some people may have heart muscle disease, also called cardiomyopathy, which is very similar to palpitations, except the chest pain or pressure often occurs with exercise or physical activity, and often occurs even with rest or after meals. Then there are symptoms of pericarditis. The chest pain of pericarditis is different from angina, which is chest pain caused by coronary artery disease. It may be sharp, often felt in the center of the chest. Patients may feel pain in the necks, arms, and backs. The pain may be worse when lying down. Before help arrives, take a deep breath in. Coughing or swallowing. Try to sit forward. Call for help or get to the nearest hospital. Additional symptoms may include low-grade fever and increased heart rate. There may be many symptoms you should know and watch out for, but there's only one solution you need to keep in mind. That is to call for help. Don't wait until you pass out or you're too weak to get to the phone. If you aren't sure if you are really having a heart attack, at least call someone who can get to you and give you help. You may have a bad heart, but that is not a big deal as long as you have a good doctor. I mend broken hearts, and trust me, a mended broken heart can be as good as new.
I'm Dr. Paul Chen. I hope that every person should pay attention to his health.
Thank you, Dr. Chan, for the care and support and technical advice given here. This is Ken Peters. Thank you for watching.